Over the years, we've talked a lot about getting help on this show, but what is therapy really like and how does it work? Here's a hint, it's not like it is in the movies. Our expert guest will explain all about the different kinds of therapy next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. Now, over the last 4 years we've done this show, you've heard people talk about how participating in therapy was life-changing for them, but we've never actually described what therapy is like. Kind of a big omission, right? Well, tonight we're righting the wrong with two expert guests who are going to give us the skinny on doing therapy, on the different kinds of therapy there are, and any other questions you might have about seeking help for mental health problems. So call now, locally, dial 218-788-2844, or call toll-free at 1-877-307-8762. And you can also email us your questions using the address listed at the bottom of your screen. Now let's meet our guests. Dr. Dan DeAllard is a licensed clinical psychologist with the Duluth Psychological Clinic who conducts psychological evaluations and provides therapy to a broad range of clients. And Dr. Carrie Van Dusen is a licensed clinical psychologist also. She's with the Northern Lights Counseling Center and provides therapy to a wide range of clients from 12 years old on up. Thanks to both of you for coming here tonight. And so I think a good place to start righting the wrong of not having talked about what therapy is like, and Dan, I'll start with you, is let's talk about describing what that first session is like, because I think that's where, if people have never been to therapy before, if they've never been in counseling, they have a lot of anxiety of oh my gosh, what is this going to be like? What if I don't know what to say? So tell us what that's like.
Sure. A lot of courage often involved just to get to the first session. Oftentimes there is anxiety, and hopefully clients will immediately feel comfortable enough to trust the therapist to guide them through that anxiety. Often the first session is pretty exploratory, where the therapist is eager to get a sense of the difficulties that brings the client in, may ask questions about some history to understand some of the context out of which the problems grew. And often an unstated but important goal of that first session is just to understand whether there's a level of fit between the client and the therapist.
Talk a little bit about that, Carrie, just that importance of the fit between the therapist and the client, and how a client even gets a sense of that then.
The fit is absolutely crucial. It is so important for the client to feel that the therapist really gets them, and also truly, genuinely cares and is on their side and very much in alliance with the client to work on the issues that they really want to work on.
And I think actually even some of the research shows that one of the most important factors in therapy and whether a person gets better or really gets the help they're coming for is that relationship between the client and the therapist. And so do you give it one session to see if you have that fit? I mean, because that's kind of tricky too, right? Do you give it one session, or is this a thing that you give 3 to 5 sessions to say, like, you know, oh, is it me? Is it me and my reservations? Or is it that we're truly not a good fit?
Like so many things related to therapy, there's no formula or algorithm for figuring that out. It has a lot to do with, you know, how significant is the lack of fit that I feel. If it's not too significant and you think maybe it's more about your nerves or your hesitancy or your, you know, reluctance to trust, I'd give it a few sessions. But if it immediately doesn't feel like a good fit, I think adopting a consumer mentality makes sense. Where you say, hey, maybe I can find another therapist in the community who does feel like a better fit, who more obviously feels tuned into me and empathic and supportive.
And maybe we should even, maybe I started even at the wrong place, and we should sort of step it back a little bit. Even if you're thinking about, Carrie, I need to get some help. And we're fortunate that we live in a large enough community that there are many different options out there available for help. How would you suggest to somebody that they go about finding a therapist for them?
One of the most useful things is to ask, if you were going to contact a clinic, to ask which therapists might specialize in the area that you're particularly wanting help with. For example, marital counseling or ADHD assessment, or say someone with a trauma history. It's very helpful to ask which therapists have a strong specialty in that area. Sometimes it is also useful to decide if you would prefer a male or female therapists. And if it also, of course, the practical issue of if your insurance covers that therapist or that clinic.
And although that's a practical issue, it's an important practical issue because one of the ways in which therapy is often different from medical care for physical health problems is it's this repeated visits in a short period of time. So this isn't just, you're not just going in for one session and then things are going to be all better. So let's talk a little bit related to that then about expectations for how long you're in therapy.
Right. So many factors influence that. In part, the severity of the difficulties you're coming in with, how often you can meet, et cetera. There's a number of difficulties that, especially if the fit is good with the therapist, may require as few as 5, 6, 7 sessions. Some require longer, but I think an expectation is that you're going to talk with the therapist after you've gotten to know each other a bit about how long this might take, and be prepared for adjustments along the way.
And so I think that that's a really good thing that you pointed out, which is talking with your therapist, and that your therapist at the end of that first session should be able to give you some inclination of, is this going to be looking more short-term, or is this going to be a more longer-term endeavor? And I know, Carrie, you work with some people with borderline personality disorder, and that tends to be an area of specialty where you see people for a longer period of time, right?
That's true. There are many people that have complex trauma where for many years through childhood, perhaps they had some sort of abuse issues, and then maybe some other issues that happen in their marriages or dating lives. And so sometimes people come in with a multitude of problems that they would like to address, whether it's an eating disorder or self-injurious behavior, or maybe nightmares from trauma, or obsessive compulsive behaviors that may go along with the anxiety. All kinds of interpersonal issues can also come up when people have complicated trauma histories.
Here is a question from a woman in Duluth who asked, what are the range of services offered by therapists? And so the way I think about that question is, so let's talk a little bit about, say, individual therapy versus couples therapy. And if you're unhappy in your marriage, how do you decide which do you do, individual therapy or couples therapy?
Again, wouldn't it be nice to have a formula for this? But in general, if you feel like you have a difficulty in your own behavior, your own moods, your own thought processes, that you can come and do productive work one-on-one with, that may be enough to help your relationship. If you feel like the problem is not so much residing wholly in me or my partner, but is between us, is in our relationship, then couples therapy is probably the right place to start. Then, of course, you run into the issue of how willing is your partner to also seek therapy. And sometimes with an unwilling partner, you can do some productive work on your own.
And part of this too is deciding as the couple, and although that often happens in the first couples therapy, are we here, are you two here for me to help you repair your relationship, or to help you decide whether you want to stay together or divorce or separate, right? That's often couples counseling can be used for that as well.
It sure can, and one of the reasons why it's so important to have a good fit with your therapist, even in couples therapy, is you want to be able to have those conversations early, and those can be hard conversations to have, even if you muster the courage to come to therapy. To say in front of your partner, maybe for the first time, I'm not sure what we can do to save this marriage. If you can feel comfortable with the therapist right away, how nice to get that on the table early, so the therapist has a somewhat accurate map of where you want to go.
Now, Carrie, you also deal with teenagers. You work with teenagers. And when you're working with teenagers, are you working with them individually or more in a family context? And so explain how if you're a parent out there and you feel like your teenager needs to get help, maybe we should even back up a little. If you feel like your teenager needs to get help, how do you get your teenager to see it your way that they need help?
Oh, that's an interesting question too. If you're a parent looking to get some help for your teenager, definitely start by talking with your teenager. Almost always, the teens I work with feel much more willing and comfortable coming into therapy if they know that much of the time, if not most of the time, they can just speak alone with me, and that most of what we talk about is kept confidential unless it's something really scary and life-threatening. Also, parents can ask their teens if there are ways that they want the parents to be involved, because there may be some sibling rivalry issues or hurts about, say, divorce. And I do find it helpful for parents to be involved somewhat, at least, to have all of us put our heads together about ways for everyone to be more happy.
So, so it's not a good idea then to tell your child that you're taking them shopping in the cities and bring them to your office. That's not the situation you want the teenager coming into, right?
Usually not a good idea.
Usually not a good idea. And
Yeah.
Dan, you work with even younger kids,
Yeah.
and so how would a parent? What's a good way for a parent to explain to say a 7-year-old
Yeah.
what we're doing this morning?
Yeah. We're going to go talk to someone today who can maybe help you sort out any problems you're having in your life. You know how you get frustrated with your brother or with me sometimes, or you feel like the teacher's treating you unfairly, or you feel really sad at times. Why don't you figure out what you'd like to change about that? And then this is a person who can help you do that. It'll be painless. It won't be like going to a medical doctor where you get a shot. It'll be a conversation. This person is going to be on your side and rooting for you and helping you. And let's give it a try and see how it goes. We'll assess afterwards how it went.
And if the child says, no,
Yeah.
I don't want to go,
Yeah.
I'm not going.
Unfortunately, though, it's often nice to win the child's agreement to going to therapy. Sometimes you say, well, I think it's in your best interest, just like we make decisions for the child about video games and food and friends that they don't agree with, but we think are in their best interest. We might still have them come and see if rapport develops despite the child's resistance. Sometimes that does happen, thankfully. Right? They don't always have to agree to that first session.
You know, and in fact, the younger the child, in some ways what I say to parents is, oh, the younger the child, the easier it is. You can pick them up and put them in the car. That's not so
Right.
easy when they're 17. It's a completely different story. Group therapy. When is group therapy indicated? And in particular, what types of problems are maybe even better treated in group therapy than in individual therapy?
Group therapy is fabulously powerful for people who have lots of shyness or social anxiety, or if they have problems where they feel very alone. And sometimes joining a group, it's very helpful in taking the shame or embarrassment away from a certain problem.
That's right.
Almost always I hear people talk about how they feel so much less alone, so much less embarrassed, so much better understood. And also there are specific forms of group therapy too. There are structured groups such as dialectical behavior therapy, which have lots of teaching in the group. And then there are others that are more open-ended and free-form, talking about issues such as divorce or trauma or social anxiety.
And we know that there are certain problems like anger management problems also that are really best almost treated in a group, because part of what the group members' responsibility is giving feedback to each other.
That's exactly right. You know, so often the feedback that you get from a peer who also struggles with the same sort of problem is more persuasive or powerful in other ways than what the therapist had to say. I want to echo something Carrie said. Behaviors that have a secretive or shameful element are often wonderfully treated in groups, because at the piece where you realize there's other folks who look like me who struggle with this too, is empowering and takes away the shame, which is often a significant barrier to being open to changing behavior.
Here's a question, Dan, from Charles in Duluth asks, are unmarried couples, so this is kind of going back to couples again, are unmarried couples handled any different than married couples in couples counseling?
Typically not. Sometimes the level of commitment can vary depending on whether you've gone through some sort of commitment ceremony like a marriage or not. But typically the issues are the same. You know, whether we're married or not, we struggle with the same sort of dynamics.
Right, and if you take a look at the issues that couples typically have difficulty with, which include things like family relationships, kids if there are kids involved, sex and money, those are the big ones, and housework, how much housework, who's doing the housework and how much they're doing it and how are you spending the money. Carrie, here is a woman from Duluth who asks, in what way can a therapist play a role with a person with substance abuse? Because we hear a lot about people like going to substance abuse treatment, and that's often a group format. Is there a role for an individual therapist with somebody who has an alcohol or a drug addiction or a gambling addiction or any other kind?
Yes, definitely there is, because very often the majority of people who have a substance abuse problem have a trauma history or some sort of history of severe depression or anxiety, oftentimes social anxiety, sometimes it's unresolved grief. And so as they are striving to deepen their sobriety, it can really help people remain sober if you also go to treat the pain beneath the self-medicating behavior that happened. Usually it's not useful to do individual therapy when someone is using a lot, because then the brain is just not completely present. So it's more difficult for the learning to happen, not that it cannot at all. But as people are going through struggling with sobriety, this can be very helpful. And also bringing in friends and spouses and partners and family members to help the client coach their close loved ones on how to support them in their sobriety, that can be very helpful too.
Let's talk a little bit about treating people with co-occurring disorders or a simultaneous sort of straight mental health problem like depression while the person is maybe thinking about but not completely sober from, say, alcohol or drugs. We used to be, back in the day, we used to say, well, we won't treat you until you get your drug and alcohol problem taken care of. And then the drug and alcohol people will say, well, we can't treat you till you get your mental health treatment, which I always felt like was it's like the person now has nowhere to go. So talk a little bit about how that's managed by how you might manage that in your own practice.
Well, it's certainly an improvement that we no longer have those attitudes as therapists. Often in therapy, what I'll do is I'll talk with the person about how the substance use problem and the mental health problem influence each other, contribute to each other, how improvements in one area might help the other. So if someone is struggling with depression that is refractory to treatment, for example, we might talk about how regular alcohol use contributes to that and how we might make more gains if you reduced your alcohol use, etc. So the intersections of the two problems, if we can focus on that, we can sometimes make headway.
And one of the therapy strategies is also this concept of motivational interviewing. And tell us a little bit about motivational interviewing and the concept behind that, Carrie.
In a nutshell, it is helping the person coming in for help to identify what their own reasons are for making any sort of changes. For them to voice out loud, maybe again and again, their reasons, their own personal reasons, because often other people will say, you should go to therapy because of A, B, and C, or the therapist will say, you should be working on A, B, and C. But really what's most effective is for the client to continue to explore what matters to them.
And motivational interviewing, it's really about helping the person to say, are you ready to be here, right? Are you ready to be here? How important is it for you to change this problem? That's the one big question in motivational interviewing. And the second big one is, how confident are you about addressing that problem or actually making the change? And Dan, talk a little bit about, I always see that second question as a little bit of, what do you mean, how confident am I to change it? I wouldn't be here talking to you if I felt like I could change it. So talk a little bit about how you even talk to clients about that issue.
Confidence that I can effectively address my problems is often unaddressed in therapy, to the detriment of therapy. It touches on some basic psychological principles that we know about regarding expectations. That if I have an expectation, a very confident, robust, resilient expectation that I can make improvements, it is easier to make the improvements. If I'm half-hearted in my efforts, if I lack confidence in my ability to make change, if I remember past failures at change, though I may say to the therapist and others, I'm ready to do this, will end up being more self-defeating than self-helping. And so exploring in a really genuine way. How ready and confident are you in your ability to do this is often crucial. And Stages of Change model and motivational interviewing has helped us focus on that a great deal in the last couple of decades.
And I think sometimes in the beginning too, that's about getting the client to say, well, maybe you don't need to trust yourself, maybe you need to trust my ability to help you. That's kind of part of our agreement. You're paying me to do my job, and and now we're getting back to that importance in the relationship issue, right, Carrie, that you were
Yes.
talking about.
It can be a close collaboration between the client and the therapist. And sometimes the motivations or issues to address in therapy will evolve and change over the course of therapy. For example, someone may come in for maybe some help with a phobia. And then as they conquer the phobia, they may have also realized, in exploring these things with my therapist on a deeper level, I've realized that there are some issues in my childhood to address, or perhaps some problem-solving skills to use on my job. And that can really evolve more easily if there's a close partnership.
Can I add to that?
Please.
Absolutely. Our goals in therapy often do evolve, and one of the indicators that you're with a therapist who's a good fit for you is you're open to the therapist's feedback about what he or she is saying as well. Almost always in therapy, we rightly start with the problems the client identifies, but sometimes we evolve in the direction of things that the therapist notices and discusses, and an openness to hearing what the therapist has to say in that regard is a mark that this is a good person for you, because you're willing to trust.
And that's a huge thing, because some of the feedback that you're going to get, because I often talk with people, is like, well, you're not coming here to tell me about how wonderful things are. So some of the feedback that you're bound to get from me is going to be hard to hear feedback, right? And that has to do with your willingness to trust, number one, that I can deliver it in a palatable way to you. But also that you have the courage to take a look at that and listen and incorporate that feedback.
I like that you use the word courage. It's often unspoken about in therapy, but it's often the key to how effectively you can use it. On top of an openness to feedback, to be courageous, to confront your difficulties, to allow the therapist to encourage you, and to be honest about the things that you want to talk about in therapy. Or if I had to put my finger on 3 things that make someone a good candidate for therapy, it might be those.
And if I feel stuck in therapy, like I like my therapist, I've been going to my therapist for a while, but I don't feel like I'm getting better, Carrie. How do I know, is it me or is it you? Or is it us?
It might be the treatment isn't also sometimes we don't even know the best treatment. Some things so the treatment hasn't been invented yet. So it's really terrible to blame the client or for the client to think it's their fault. However, if it feels like there are big obstacles in the relationship, they can be addressed in the context of the relationship. Or if there are some obstacles within the client, like say some secrets that have been difficult to share, those can be addressed. It's very important to see exactly what is getting in the way. And sometimes people have also reached a plateau in their recovery and they're doing pretty well. And sometimes it's useful and refreshing to take a little bit of a break from therapy and then either come back as needed, or if you really want to, you can certainly switch to a different sort of therapist.
I think that's wonderful, that notion of taking a break, like you're 70% better, and that it's okay to take a break and see like maybe you can do the rest on your own. Maybe you've gotten to the point where like this is good enough for now. We're coming up short of time, and so parting words, Dr. DeAllard.
Parting words. Look hard for courage to go to therapy. Be open to what your therapist has to say. Be as honest as you can be.
I think those are wonderful parting words. Thanks to both of you for being here. I can't believe how fast this happened. Therapy can truly be a wonderful thing. It can be life-changing, just as you've heard many of the guests over the last 4 years talk about. And as one teenager once said to me, I don't know how my friends do it without a therapist. So if you're out there feeling like you need some help, pick up the phone, give somebody a call, and be brave. Just be brave and do it. You won't regret it. Thanks so much for coming and tuning in with us tonight. And don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links, and read my blog, the place where I'll answer a few more of your questions. You can also email us your questions about next week's show, when we're going to be talking about kind of the other side of it, medications. We haven't done that show either, and their role in treating mental illness. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.